Hello viewers, this video demonstrates a single portal subscapularis repair inside the box technique. So this is the view through the posterior viewing portal where you can see the subscapularis lying there anteriorly. Entire portal is made to further evaluate the subscapularis tear and clear all the adhesions. So first we enter through the entire portal, place a wand and start doing our releases. So subscapularis requires a 270-degree release from superiorly, from anteriorly and from posterior side. So this is a thickened MGHL which is resected, and the whole subscapularis is released from superior side and we are able to completely evaluate it. The belly of subscapularis. Once the releases are done, further visualization is enhanced. Then you go on posterior side for further releases. You release it further on posteriorly. The capsule is released. Then you are able to visualize subscapularis tendon, which is looking more normal when viewed through the posterior portal. And you can see the biceps also looking mostly normal. Now we need to further evaluate the subscap. So we take the upper limb in further forward flexion and see. You can see a subscap tear. The peeling of subscap is there. Upper third subscap is peeled off, and this maneuver in forward flexion will help reveal the tear. So we now further finish our posterior releases. The capsule is released along with the ligaments posteriorly. Once the release is complete, then we'll further evaluate the reduction. So you can see the small bleb out there, which is probably the place from where it is torn and peeled off. You can see the conjoint tendon also anteriorly. So we'll do further releases. That's the anterior part, that's the conjoint tendon we are able to see. And then you do further releases. This increases our visualization for suture management. So we have a clear anterior space so that we can place sutures out there, take bites and place knots. So you can see the loose tissue is further cleared to improve the visualization out there. So once our visualization is proper, we can place the portals or the cannula so that we can do our further repair properly. This patient also had pasta lesion, so the tissue was debrided and was repaired after the subscapularis repair. This repair we are doing without doing biceps tenotomy or tenodesis because the quality of biceps looks good. So we will perform a single portal repair without doing a biceps tenotomy and placing only a single portal. So here we are placing a single portal, a large 8.5 mm cannula. So through this cannula we will place the anchor, we will take the bites and we will place the knots all through the single portal. So this is a double loaded metal anchor so once we have placed the suture anchor, we have 4 sutures out there through the cannula. So now we remove this cannula and sutures are then outside the cannula and reinsert the cannula. So all the sutures lie outside the cannula. and we will take the bites one by one. Now sutures are outside the cannula and we retrieve the sutures in the cannula one by one. Then we place any of the lasso kind of instrument through the same portal, and we plan to do a repair in a Mason-Allen suture configuration. So this is the first bite, the superior bite of the mattress suture. So we shuttle it with proline, and once the proline is there, you should take the proline suture through the cannula, load the suture which we have retrieved, and then shuttle over the proline. Once the suture bite is taken, then you retrieve the same white suture in the cannula, and then we take the second bite with the same suture lasso slightly more inferiorly. So here comes this lasso and taking another bite inferiorly. Yeah, so a proline is passed through the lasso, taken back through the portal and shuttled over the same white suture. So that will complete our first mattress stitch. Yeah, so this suture gets shuttled and our first mattress stitch is taken. Then we go for the simple stitch. So now the retrieving the other tiger suture, and we need to take a bite which is further medial to the present bites, existing bites of a mattress suture. So you take a bite with the same lasso slightly more medially. So you get a more medial bite, shuttle it over a proline, so this completes our all the sutures bites that we have taken. Then we need to place the knots. So we place the knot first on the mattress stitch. So we will retrieve or separate only the white sutures. Yeah, so you take only the white sutures through the portal and start placing the knots. We can place a sliding or a fixed knot. So 5 to 6 multiple half hitches are placed. Now we can see we are obtaining the closure of the subscap tear. Once our knots are placed, we cut the suture and now we'll paste the knots on the simple stitch. So we retrieve one suture which we have now taken the bite, and then start placing the knot. Multiple half hitches are placed. And we cut the suture, and this is our complete repair of subscapularis inside the box, done with a single suture, single portal only. This is the final repair that we have achieved. You can see complete closure of the torn subscapularis. This is the final repair. Thank you for watching this video.